Good afternoon. Thank you for taking time from your busy schedules to join us for this webinar entitled Human Trafficking in Adolescents, Understanding the Issues as a Service Provider. If you are a social worker, there is an opportunity to receive credit for this webinar. Additional information was provided in the reminder email sent from WebEx at 10 a.m. this morning. If you wish to obtain these credits, please note you must be logged on as an individual, not in a group, to be eligible. You will also need to complete the online survey that will pop up when we end the webinar. None of the presenters have anything to disclose. If you have questions or experience any difficulties in obtaining your continuing education, please send an email to kimsloafk@email.chop.edu. This webinar is being hosted by the Violence Prevention Initiative at the Children's Hospital of Philadelphia. This is a CHOP-wide evidence-based effort to protect youth from violence. VPI's trauma-informed programs prevent violence and aggression, support at-risk populations, and help our patients heal by providing the right care to the right children at the right time. My name is Marné Castillo. I am a research scientist in the Division of Adolescent Medicine here at CHOP, as well as a VPI Fellow. Our goal today is to address the issue of human trafficking within pediatric healthcare settings. The objectives of today's webinar are: define human trafficking and other related terms, identify signs that your patient or client may be a trafficked youth, identify root causes of trafficking and transactional sex, explore your role and responsibilities as a social worker, identify resources to assist clients who are victims of trafficking. When many of us hear of sex trafficking, do any of these young people come to mind? If one of them came into your hospital or clinic, would you think they could be a victim of trafficking? Many myths and misconceptions surround youth sex trafficking, also known as human trafficking or commercial sexual exploitation, and keep this as a complex and unaddressed form of violence against children and adolescents. In fact, the true scope of this issue remains largely unknown. Estimates of the number of youth affected in the United States range anywhere from 1,400 to over 2 million. However, more reasonable numbers estimate that approximately 100,000 youths are victims and another 300,000 are at risk. Identifying victims is the first step to getting them to care. However, it is often the most complex step. At the Children's Hospital of Philadelphia Adolescent Initiative, we focus on HIV research, prevention, and care. As such, we encounter youth in a variety of settings. Our work depends on the ability to address the array of factors that places adolescents at risk, including insecure housing, poverty, abuse, and what we will be discussing today, youth sex trafficking. Oftentimes, what we may see as their most dire circumstances not the most critical to the young person. Improved health outcomes rely on making safe and appropriate linkages for youth, and these can be made through non-judgmental communication and consistent support. Case managers and other adolescent providers can provide a crucial role in working with youth to get their priorities met, especially when we can do it in a non-judgmental way. Our presenters today will give us some poignant case examples and tools to do this. Before I introduce our speakers, I'd like to address a few housekeeping items. First, if you are having technical difficulties, please reread your confirmation emails. The latest one was sent to you at 10 a.m. this morning. In the emails, you will find links to join the meeting and to download WebEx Event Manager for first-time users. You should hear the audio through your computer speakers. There's not a call-in phone number for the audio. At this point, we will not be able to help you with technical issues. If you have questions for the presenters as we go along, please type them into the chat text box in the bottom of your screen and direct them to our host, Lindsay Mitros. There will be opportunities to ask questions throughout the presentation, as well as approximately 15 to 20 minutes of time designated for questions and answers at the conclusion of the webinar. Because of the large group, it is not possible to open the lines for audio or verbal questions. Also, other participants will not be able to view the questions or comments you submit. From previous webinar feedback, we've learned this can be very distracting for the participants. And lastly, this webinar is being recorded and will be posted at www.chop.edu/violence within the week. We have close to 300 people registered for today's webinar, speaking to interest and concern in addressing the issue of child trafficking. Among participants, we see people from many disciplines: social work, juvenile justice, public health administration, health educators, as well as many locations: Texas, Florida, California, and even as far as Canada. If we're not describing your role or location, please text us in the chat box and let us know. Now it is time to introduce our speakers. Erica Smith, MED, is an adolescent case manager for the Adolescent Initiative at CHOP and the Philadelphia Juvenile Justice Services Center. Jasmine Oglesby, MSW, is a prevention case manager for the Adolescent Initiative at CHOP. I will now turn the mic over to Erica and Jasmine to share a bit more about the Adolescent Initiative and to introduce us to the issue of youth trafficking. Erica, Jasmine?
Good afternoon, everybody. Thank you for attending, and thank you, Marné, for the introduction. So, we invite you to share your thoughts briefly. What is the first thing that comes to mind when you think of human trafficking and when you think of adolescents in human trafficking? We invite you to chat your response or your first reaction. We'll wait just a moment to get a few reactions. They're coming in. So some of the reactions that folks are giving us are some that we expected. We're seeing Law and Order SVU, the movie Taken, folks who have been kidnapped, more prevalent than we think. We're seeing answers like homeless youth, children lacking support and resources, youth of all ages, and immigrant communities having a high rate of this issue. Thank you all for participating right away. So you will see as we get really into the content of this webinar that a lot of those answers are the things we're going to explore, and we'll talk a little bit about what trafficking doesn't look like. So to begin with some basic definitions, what is adolescence? For our purposes, adolescence is the period of years between 13 years old and 24 years old. It does extend into adulthood beyond what we consider legal adulthood in the U.S. So people who are 18 and legal adults are still considered to be adolescents. We would like to begin by talking a little bit about our program, the Adolescent Initiative at the Children's Hospital Philadelphia, and letting you know how we come into contact with trafficked youth. So the Adolescent Initiative is a program that provides clinical care research and prevention services to teens that are either at risk for HIV or living with HIV. And what our goal is to bring HIV positive and high-risk youth into an environment where they feel most comfortable receiving their health care. So we have three different parts of our Adolescent Initiative. We have the part that provides clinical care for youth living with HIV, an arm that provides research and collaborative public health partnerships, and another part that is HIV prevention focused, and it targets adolescents in community settings. And one of those settings is juvenile detention, which is where Jasmine and I work specifically. So inside the Juvenile Detention Center, what we do is identify youth that are considered highest risk for HIV and provide intensive sexuality education, advocacy, case management, and support. So you'll see in these boxes the three populations that we specifically target, and this is because they are the populations that have been identified as priority by the CDC, or Center for Disease Control. And that is the gist of our Adolescent Initiative program. To tell you a bit more about the facility in which we carry out our work, the Philadelphia Juvenile Justice Services Center, or the PJJSC, is operated by the Department of Human Services here in the city of Philadelphia. The Department of Human Services is our child welfare protection agency in this municipality. And the facility provides temporary care for young people in this holding facility while their court proceedings are being held and while the city is deciding where youth should be housed or placed after their court proceedings have finished. The facility itself has 105 beds, and throughout a year there are an average of 5,000 youth housed within the facility. The average stay is approximately 6 to 10 days, though of course there are many youth who are only there for a few hours and other youth who remain for many months as their court hearings are held. Some of the factors that could influence the length of a person's stay within this facility are a particular person's individual needs. They may have complex health needs that need to be resolved before they go to their next location, for instance. It depends on available resources or places to house young people based on the needs that are identified and the complexity of their legal proceedings. And it should be pointed out that many of the youth who are deemed to be victims of human trafficking do have pretty complex legal proceedings. Also, these pictures, in case you were wondering, are actual pictures from inside the PJJSC itself. Now we're going to talk a little bit about the risk behaviors that our program has determined are HIV risk behaviors. These are the things that we're assessing for when we're seeking young people who may be appropriate for our program. So I'm going to let you take a look at some of these things. You will see that one of the things we're looking for is youth who have been involved in commercial sex work, survival sex, or are victims of human trafficking. And we will explain the difference between those terms coming up shortly. So our services. The next two slides illustrate a number of the services that Erica and I provide for young people who agree to participate in our program. I won't list them all for you. I know you're able to read, but I wanted to let you know that our services stress education, advocacy, and linkage to health care and additional supportive services that may impact sexual decision-making and a sense of personal agency in one's own health and well-being. So as far as the number of youth who are trafficked and who are patients of the Adolescent Initiative, this is not something that we officially track, but based on our estimations of over 15 years of our program's operation, we have determined that only about 15% of the youth have been classified as victims of human trafficking, but that many, many more engage in commercial sex or survival sex that does not involve a third party or what we would think of as a pimp. So that would be to us at least 80% of the young people we work with have had some kind of sexual encounter that resulted in the exchange of money or goods, and that there was not a person forcing that encounter.
We would now like to invite participants to write any questions they may have for Erica and Jasmine, and the information that they just presented in the chat text box. As a reminder, only the moderator and the presenters can see your questions. We have a few questions coming up. Thank you. And the first one is, so does transactional sex qualify as a trafficking issue?
So yes, that question and another one we're getting, which is what is the difference between commercial sex and survival sex, we're about to address all of that in the upcoming slides. I would like to address the question, how are trafficked youth accessing your services and how do they find their way to health care? So our program is specifically targeting young people that are being held in detention. And while they are in detention, they have the opportunity to meet with our program and access our services there. And that does include HIV testing and education, and there is a medical facility inside the detention center. And how long have we been working with youth at the PJJSC? Our program has been off the ground since 2002, and I have been there for 15 years and Jasmine for 14 years, so quite a while. One more question before we move on is that, is there a difference in how youth who are under 18 are treated by the Pennsylvania legal system? And is this anything like the New York State Safe Harbor legislation? That is something that we will get into a little later, but we very much appreciate that issue being raised. Okay, so you all are right on time, segueing us into our next segment. What is human trafficking? It should be noted that for our purposes, we will be focused on domestic issues of trafficking. We are not going to focus on international issues and immigration needs. So the Department of Homeland Security defines human trafficking as the recruitment, harboring, and exploitation of people being brought into or living in the United States for labor through the use of force, fraud, and coercion. You will hear us refer to those three things several times during this webinar: force, fraud, and coercion. So by force, we mean either physically or psychologically forced into sex work or into sex trafficking. Fraud, meaning being tricked into thinking that someone might be going into another kind of work, for instance, possibly a modeling job or agreeing to being an au pair. And coercion, an example of that would be comply with my wishes or I will evict your family from their home. And this kind of labor does include but is not limited to sexual labor, but that is what we are talking about today. So you may hear us use the term survival sex, and to us this is the exchanging of sexual behaviors and acts for basic subsistence needs. And this is something that you'll see homeless youth having to engage in quite often because they need things like clothing, food, and shelter. And the term survival sex is not limited to sexual intercourse. It can also include, there is street-based sex work, which is like when you stand outside and you wait for someone to pick you up. But there are also, this would include exotic dancing, escorting, massage parlors, phone sex services, and more popularly nowadays, camera work on the internet. Commercial sex or transactional sex is the exchange of goods or money for sexual services. Generally, well, it always involves a sex worker and a client. It may also involve a third party or a pimp. The commercial sex industry is the commercial sex complex or the marketplace, as it were, for these transactions, whether or not everyone in these transactions is consenting or not. And the term sex workers refers to women, men, and transgender people who receive money or goods in exchange for sexual services. They would also have to consciously define those activities as generating income, even if they would never consider sex work their primary occupation. And this population absolutely includes adolescents. Trafficking versus sex work, or sex trafficking versus sex work. According to the legal definitions, sex work can only be categorized as human trafficking if there is the presence of again, force, fraud, or coercion, meaning sex trafficking or just human trafficking is not necessarily a generic term for engaging in all manner of sex work. But the big catch is that law enforcement considers any person under the age of 18 participating in commercial sex work to be a trafficked person. And this is whether a third party or force, fraud, or coercion is involved. So again, any person under the age of 18 under federal law who is participating in commercial sex work is considered a trafficked person.
At this time, we'd like to invite you again to please type any questions you have into the chat text box at the bottom right of the screen.
I'm seeing a question that says, do you find that most of the youth in the detention center are receptive to services? Generally, yes. Most of the youth that we introduce ourselves to and assess are receptive to our services. One of the main reasons is because our services are voluntary. There aren't many things that young people who are held in detention or incarcerated can say yes or no to. And they can say yes or no to our presence and to our services. And that is a very, very helpful tool. We want to make sure that no one who is speaking to us about their reproductive health or their experiences with trauma or with their or any of their sexual experiences is doing so because they feel like they're doing so under duress. So one question we have is, to clarify, a person doesn't need to have a pimp to be considered trafficked. And if you are under 18, this is absolutely true. And then another comment is the underage reference is similar to statutory rape. In other words, children cannot legally consent. So the age of consent to sex varies by state to state, but as far as federal law and trafficking, that is a hard cutoff at 18. So if you are under 18 and doing any kind of sex work, you are considered trafficked, whether or not there's a pimp involved. I'm seeing a couple of comments. Folks in the Metro Philadelphia area might have referrals for us, and we will share our contact information at the end of this webinar. We're happy to help or to refer to other resources if we are not the right people. Another question that would be great to address right now is, are the youth in your program in detention for trafficking-related crimes or usually something else? So all of the young people that we meet at the detention center, in Pennsylvania and in Philadelphia, a young person under 18 cannot be charged with prostitution under a law that actually the Pennsylvania State Senate passed in April of this year. So the kids we work with are usually charged with other crimes that are a result of poverty, things such as drug charges or assault charges for trying to survive or to get away from a pimp, theft, lots of theft, retail theft, so any manner of things that you might see associated with homeless and runaway youth are the things that the young people we work with are charged with. There is one question, is there a support program for previously trafficked youth? I know that in Philadelphia, we're going to talk about a court program, and there is also a program through the Salvation Army in our city, so we would encourage you to investigate what's available in your own municipalities. All right, we're good.
Next, we will turn again to Eric and Jasmine to discuss the role of third parties in human trafficking and what the risk factors are for these victims.
We wanted to take a few moments to talk about awareness campaigns. These next few slides are images from various awareness campaigns about the issue of sex trafficking. They are designed to inspire emotion and concern, of course. As you can also observe, the images tend to be of young, attractive, white or light-skinned women. Some of these images are racialized or have heightened sexual overtones, and the presence of a third party is either explicit or implied. So we wanted to not only show you some of the popular campaigns, but to present some criticism of the campaigns by advocacy organizations that work with youth. Some of these campaigns and the imagery you've seen have been criticized for dismissing the needs of the majority youth in the sex trade that are not being coerced by third parties. They've been accused of employing scare tactics that present all children as being trafficked or as potential victims. They've been accused of presenting a sensationalized version of trafficking as the only version of trafficking. The movie Taken would fall into this. It's quite a sensationalized version of trafficking, which presents like a American young woman being taken by a man of a different ethnicity and taken to a different country. These campaigns have also been criticized for not addressing the social realities that affect many trafficked youth, such as poverty, homelessness, and involvement in the child welfare system. So advocacy organizations that work with sex workers of all ages routinely report that the adolescents they most often work with and that participate in sex work are not working with a pimp. They are noticing that young people do engage in sex work due to a lack of other commodities and support. So they're doing it for basic needs such as shelter and food. And these agencies also notice that their clients do not tend to share life experiences that are similar to those resembling human trafficking awareness campaigns or similar to the depictions of sex trafficking in television and film. As we mentioned earlier, Law & Order SUV or the movie Taken are definitely not the only picture here. So this slide is important because it shows how many young people in one particular study of 300 sex working minors in New York City are actually involved with pimps or under the control of a pimp. So out of the 300 young people surveyed, only 10% were under the control of a pimp, and only 95% of those young people had exchanged sex purely because they needed basic needs and financial support. And we do see this in our work. The majority of young people that we work with are not under the control of the pimp and are involved in sex work for purely survival reasons. This slide is based upon information shared with us by people with whom we have worked over the years and from various information sites and articles that we have read in our research. This is about what sex work can look like for folks who are not working with a third party or a pimp. Frequently, this work is self-directed, meaning someone might post an ad in their own time and answer those ads at their own time. There may be just a small handful of regular people that a person sees for transactional sex. It may not look like stereotypical depictions of prostitution, as Erica previously said, in film and on television. Folks may be exchanging sex or sexual favors for other needs that need to be met, like please pay this phone bill. Someone might help you stay in their home during the winter months. Some people might exchange sex with someone who gives them money on occasion. Many youth who engage in this kind of work might not think of themselves or think of this work or define themselves as prostitutes or sex workers. Many young people have told us that they work together in order to ensure each other's safety by doing things like going to a date with each other, accompanying a person to a date, checking in with them at regular intervals on the phone. And some people's first experience doing this kind of sex work may be unplanned. And an example of that would be that we spoke to a young woman who went to a party. She met a man at this party. She and her girlfriend met some men at this party. She went home with this young man. They had sex, and the next morning he gave her money. She had not expected to receive money from this person, but he gave her money and she accepted it and was happy to know that she might be able to visit this man again if she ever was in need of money. So we really want to stress, again, under federal law, young people cannot consent to sex work and it is considered trafficking, but we want to make the distinction that a lot of our youth have more agency than a young person who is under control of a pimp. So it's all considered trafficking under the eyes of the law, but there is more agency if you are not working for a pimp. There's a question that's actually relevant to this slide. Somebody wanted to know, do youth who engage and bring other youth into sex work or trafficking get charged if they are working as pimps? This is an interesting question. We actually have a case in Philadelphia right now where a 15 and a 17-year-old girl are, the courts are attempting to charge them as pimps, and their public defenders are arguing that under the law, the safe harbor law, they cannot be charged. So that is still a case that is happening actively, and it will be interesting to see what the outcome of that is. There are definitely young people who get involved in recruiting other girls, and the way they are charged is really going to vary from jurisdiction to jurisdiction.
And we can continue with questions and discussion from Jasmine and Erica. If folks want to add some text into the chat box, we'd be happy to take a look.
So referencing the study of 300 young people who are engaging in sex work in New York City and saying that most of them do not have pimps, one of our participants wondered, is it possible that the number is higher and they're afraid to say they have a pimp? That could be a possibility, though I am guessing that this was an anonymous survey so that there wouldn't have been any danger to the young people for speaking up. I think it's also important to point out that the lines between pimp and boyfriend can be very confusing for people sometimes, and we're going to talk about some of the life experiences that put people at greater risk for being victims of human trafficking or being recruited into this kind of work. And some of that involves trauma, and that can make the line between their third party as a pimp versus a boyfriend very confusing. One person wondered what the safe harbor law is. So this is a law, at least in Pennsylvania, the PA State Senate passed this in April of 2017, and it's a law that makes juveniles immune from prosecution for prostitution. Another participant mentioned that that law also applies in New York State, so we would encourage folks to look and see if that law is applicable in their states as well. One of the questions is also, do you find that sex workers have a trauma history, such as childhood sex abuse, or have been exposed to sexual activity? We will discuss some of this in upcoming slides. So a really great comment is, I'm really struck that none of the anti-trafficking ads highlighted any young men or transgender youth. Are you aware of any such campaigns? So this is an interesting experiment you can do yourselves. If you go into Google Image and search trafficked youth look at the photos that appear, and they by and large are of young white women who appear to have been coerced by a third party, usually a darker skinned person. Off the top of my head, I cannot think of any major anti-trafficking campaign that specifically highlights young men or trans youth, so we know from experience that they are victims of trafficking as well.
Thank you again for all of your questions. And now we're going to continue. Erica and Jasmine are going to share some case examples from their experiences.
We're going to share with you a few case examples, as Marné just said. We should mention that these are not the actual first names of the human beings that we are talking about. We've changed their names to protect their privacy and to respect HIPAA. We will begin with Aaron. Aaron, when we met him, was a 16-year-old white cisgender male. He ran away from his home in Florida due in part to addiction in his family and because of family violence. He engaged in sex work with adult men. He was identified as a victim of human trafficking and held at the Philadelphia Juvenile Detention Center after crossing state lines with an adult male who was not a relative. He disclosed to us that he considered the men in these transactions to be sugar daddies because they provided for him in ways that his family did not due to their struggles with addiction and violence in the home. Sheila. The next case we would like to highlight is Sheila. Well, we met her when she was a 14-year-old girl. She's African American. She was in detention because she'd been arrested for prostitution. So this was before the laws had changed, saying that you couldn't prosecute a minor for prostitution. I believe it was 2009. So she returned to detention several years later when she was 17, and we continued our work with her. By this time, Sheila was addicted to cocaine and pills. Though she wanted to stop and tried to stop doing sex work, she continued due to her addiction. Sheila was in and out of detention and other placements throughout her teenage years and early adulthood, though she continually asked for drug treatment to address the root of the problem. When she was 18 and then 20, she still struggled with addiction, continued engagement in sex work, and arrests, which now included adult charges for prostitution since she was over 18. Throughout these years, she was trying to hide from a pimp who continued to track her down, even once at a safe house. Sheila once confessed to us that out of the many juvenile placements she'd been in only one of those facilities had a male staff member not had sex with her, which, as we clearly understand, would mean she was sexually assaulted by the people that she was supposed to be in the protection of. Sheila was found murdered in late 2016 when she was 22 years old. When we met Trina, she was a 16-year-old white young woman with an extensive history of sex work. She had an active crack cocaine addiction for at least a year. Her mother, who had a similar history, was the first person to give Trina crack. She ended up in a detention facility wanting very badly to have drug treatment. The juvenile justice system continued to send her to residential treatment facilities without drug treatment programs. Trina ended up in a cycle of running from placement, relapsing, and resuming sex work. Simultaneously, Trina's mother continued to struggle with addiction and arrests, and Trina worried about her constantly. By age 18, Trina was working with a pimp who was also her boyfriend. Though she also carried several adult criminal charges, her juvenile case remained open and she continued to be held in the juvenile system. Her pimp was eventually incarcerated on human trafficking charges, but remained in contact with her through letter writing. He was violent toward her and she wished to continue engaging in sex work independently, without his involvement. Sobriety was her highest goal. Trina died at the age of 23. We are unsure if her death was due to violence, addiction, or suicide. Brandy. Brandy was a 15-year-old African-American transgender female when we met her. This means that she was assigned male at birth, but identified and lived as a female. Her family was greatly displeased by this and abused her verbally and physically. The insults and rejection were rooted in homophobia and the hatred of her trans identity. Brandy alternately fled and was kicked out of her home as a teen. In order to survive, she turned to sex work. She was acting without a pimp and was arrested for prostitution, again before the laws were changed. She continued to engage in sex work as her primary income for many years, advertising online and always working without a third party. Many of her friends and peers, other transgender girls of color, were doing the same, so it was quite normal to her. Most of the sex work she did in her 20s was done with a handful of long-term regular clients. Today, Brandy is a happy, healthy, and successful 30-year-old artist. She continues to use transactional sex occasionally as a supplemental part of her income.
When we met Maxine, a young white 17-year-old female, she disclosed to us that she had previously been kidnapped by a pimp at age 12 when she was homeless, and she spent her teen years under the influence and control of pimps, running away from group homes to be with them. She reported being under the influence of drugs for many of these years. She reported being kidnapped more than once by pimps. She experienced a tremendous amount of abuse at the hand of these pimps, including being pistol whipped, shot, and beaten until she miscarried. It almost goes without saying that in every example we have provided, youth have experienced very violent rape, coercion, and assaults throughout their youth. Maxine was eventually rescued by the FBI, and she testified against one of her pimps. Our last update about Maxine is that she ran away from a group home in which she was residing, and her whereabouts are unknown to us. Her pimp was found guilty in 2016 of sex crimes, including human trafficking, rape, assault, and promoting the prostitution of a minor. He was sentenced to 48 to 96 years in prison. Okay, so we've shared with you some heavy case examples, and you may have seen some themes, some threads running throughout some of these stories. So we will break down some of the risk factors for young people a little bit more directly. Some of the things that we are screening for, and we probably you all are as well if you're working with any of these youth, are a disclosure of a history of trauma, whether that be sexual trauma, physical trauma, or emotional abuse, unstable or neglectful or abusive home environments, a lack of family or other social supports, which is especially a concern for LGBTQ youth who are disproportionately represented in our country's young homeless populations due to family rejection. We're also screening for, as I just said, things like homelessness, transience, or unstable housing. Folks who are involved in the foster care systems and the juvenile justice systems, young people who are in poverty, young people who have developmental or learning disabilities, especially when coupled with some of these previous risk factors, folks who have survived previous trauma, including trauma endured in war and trauma that was suffered in the juvenile justice or social welfare systems. Also, we are screening for folks who may be immigrants without these social supports as well, especially those with a language barrier. Some statistics from the National Center for Missing and Exploited Children. As many as a third of the teens who have run away from home will be involved in sex work within the first 48 hours of leaving home. And almost 90% of young people who are sex trafficking victims were in the care of social services or the foster care system when they went missing. So this is obviously a vulnerable population of young people. So
if there is a pimp or third party involved in coercing a young person into sex trafficking, there are various ways of recruiting. One of the biggest ways is to offer love, support, affection, and emotions to a young person that may have not received much of that at home and may not have access to that otherwise. So we have worked with a lot of young people where, as Jasmine stated before, the line between pimp and boyfriend was quite blurry because it's possible that the person first presented himself as a boyfriend and they began a sexual relationship, and then there would have been a shift where it was introduced that there is an expectation that you're going to have sex with these other men. That does not mean that the emotional support, love relationship part ends necessarily. That is what makes it especially entangled. Besides this, there are also pimps who just straight resort to physical and emotional abuse, repeated sexual assault, and introducing drugs. We've worked with young people that have been under the control of both types of pimps, and often the lines are very blurry between those two types. It is not uncommon for young people's ID and money to be confiscated so that they become dependent on this third party. It is not uncommon for them to become isolated from friends and family intentionally and to use a different name while doing sex work. And it's possible that the other people around them at this time may not know their real name at all. Who is buying? So this slide is here to illustrate that mostly men are the people who are paying for transactional sex, and it's men from all walks of life, all socioeconomic statuses, races, ethnicities, religions, etc. There's no one type of stereotypical man that is, portrayed on television or in the movies who is the only proprietor of sex workers. They are married men, they are men with children. None of these other aspects of their lives preclude them from paying for sex. Where does this happen? Sex does happen in major metropolitan hubs, at airport hotels, interstate hubs, and large events, which are the things that I feel like we're all more familiar with hearing about. This work, though, also gets done in private homes, suburban towns, rural areas. It's happening virtually everywhere, all the time. So sometimes folks wonder, why don't these young people leave? And this is the same question that people ask victims of domestic violence or intimate partner violence, and the reason that the trafficking victims don't leave are pretty much the same. There can be actual physiological coercion. There was a case recently in Philadelphia where a young woman was allegedly held captive at a hotel in Northeast Philadelphia for up to 2 years while she was being trafficked from the hotel room. So if you think about that, a lot of people were complicit in the holding of one person in a hotel room for 2 years. This woman couldn't get out. There would have undoubtedly been the use of weapons to keep her there. In addition to the physiological coercion or force, a lot of young people bond with their pimps. And the way that we described earlier, often the pimps are offering them love and support. So sometimes the young people are raped by other men, but other times they feel like they are with their boyfriend and he is providing them with love and security. It's also really important to note that alternatives often are not much better. If the alternative to having sex for money under the control of this man is going back to the house where your family beats you, or going to a homeless shelter, or going to a group home where you're going to be the target of a bunch of other girls, you might not be that quick to go. And a former sex worker stated that sometimes doing sex work is the least crappy out of a lot of crappy options. And somebody who used to be a pimp and now speaks out in defense of trafficking victims said that the best victims for him were always the ones who did not even recognize that they were victims. We would like to highlight this young woman's quote because it really speaks to what we were just saying. She said, I got upset when I realized what he was doing, but I kept doing it because he made me feel like I was special.
Thank you, Jasmine and Erica, for those important stories. We're going to take a break from that for a few minutes to take some additional questions before we have them continue.
So one person asked, we spoke about a young man named Aaron and how he was brought across state lines by an older man who he considered his sugar daddy. And someone wanted to know, like, so the young person was held in detention for their safety, but what about what happens to the man? And ideally that person would be prosecuted under many laws, trafficking or statutory rape, but I mean, a lot of times what happens to the PIMPS is not something that we know or have access to because our focus is on the victims.
I saw a question in the feed that was asking about whether young people are charged as sex workers or as people who are trafficked. And the answer is no. Now the answer is no, in Philadelphia anyway. And usually, as we've been told by the young people, the folks who are defending them in their situations have informed them that their cases will be expunged when they are 18 or when they are discharged from all of their court proceedings.
Someone asked, do some youth who are trafficked eventually turn into PIMPs themselves? And this is absolutely the case sometimes. Often, if a young person is trafficked and they're under the control of a pimp, they realize that they can gain a little more favor and maybe a little better position if they do some of the recruiting of people underneath them. So it would be another survival tactic, essentially.
I'm seeing a question from someone saying, if a person under 18 were picked up on another offense, would you not treat them or work with them? Absolutely, we would work with them. One of the earlier slides that we had up was basically saying that on our caseload, approximately 15% of young people that we are working with are considered or categorized as victims of human trafficking. But based on our conversations with them, approximately 80% of the young people that we are working with, not charged by the court system, not known to the court system, not categorized by the court system as sex workers or people who are victims of trafficking, have engaged in some kind of transactional sex at some point.
I see a really great question. Someone said, because a lot of victims choose not to leave or don't recognize their victims, what are your goals when you're working with these clients, and what are some short-term goals you work on? We deeply understand that young people cannot just be told to stop doing this and that that's what's going to happen. So the goal of our program is optimal sexual health for adolescents, and we, in the short term, try to connect the youth to services where they can seek testing, preventative health care, treatment. We make sure that they have basic needs in place. If they need food, if they need shelter, we have social service providers help them with that. And we also have a lot of conversations with young women about sexual agency and how they feel that they can be the decision makers when it comes to their sexual health or when it comes to their sexual partners. And this is not something that happens overnight. It is a process that can go on for years and years.
All right, thank you again. We're moving on. So outcomes. Some trafficking victims, many trafficking victims, may experience the same outcomes as sexual assault victims or survivors. Some of the things that may occur for people are physical or psychological or reproductive health consequences, trauma-related psychological disorders. We work with many, many people who have been diagnosed with PTSD or post-traumatic stress disorder, depression and anxiety, along with a host of other psychological diagnoses. Folks are at risk for an increased suicidality and increased isolation, social isolation. Some of these outcomes can also increase the likelihood for negative health impacts, as I said, but they can also increase the chances of involvement with the justice system. Some folks may sustain injuries on the short or long term that are similar to those of victims of torture, including malnutrition, broken bones, burns, concussions, and of course, one of the things that Erica and I are mainly engaging with people about is their reproductive health. This includes multiple pregnancies are possible with varying results, HIV infection, and reoccurring STI infections or multiple STI infections. And all of these things may be made worse or exacerbated by spotty or irregular or no health care. So I mentioned a moment ago that we really work with young women to make them feel like they can have more agency over their sexual decision making. And we really want to emphasize that when young women or young people are forced and coerced into sex at an early age and subjected to multiple sexual assaults at an early age, it can very much reduce their ability to see their sexuality as something over which they have control. So as a result, it is less likely that these youth, it says adolescent girls here, but any adolescent youth that are victims of sex trafficking, it is less likely that they will feel empowered to use protection in the future because they're just not used to having that kind of agency. And of course, we did tell you a couple stories that had the most tragic outcomes where the young people lost their lives. And in one case, we're not really sure if this was due to suicide or drug addiction, but we just want to reiterate here that this physical and sexual abuse can lead to severe mental or emotional health consequences, severe guilt, PTSD, depression, anxiety, substance abuse, and eating disorders. So what do people need? The next two slides are a list of some of the potential needs of survivors of human trafficking. I, again, won't read all of them to you, but they are a collection of very immediate services that folks might need, as well as a host of comprehensive longer-term services. Assisting people toward sustainable stability requires detailed access to services and resources. Happily ever after takes work, and people changing their lives may require immediate as well as long-term support. We wanted to highlight one particular court program in Philadelphia. It's referred to as RAP Court, and that stands for Working to Restore Adolescents' Power. Children who have been arrested and identified as victims of sex trafficking are offered an opportunity to participate in this program. The goal of the program is to work collaboratively with the child to promote treatment, healing, and restoration, and ensure safety of the child victim in the least restrictive setting possible. So this means that if the young person is arrested for crimes that directly result from their sexual exploitation, that might mean things like retail theft, false identification, assault, robbery, drug charges, rather than punishing them and adjudicating them delinquent, this court program will divert the child from the adjudicatory system into the child welfare or dependent system. And this, the ultimate goal is to empower them to heal and move away from their trauma, not to punish them, but to get them help. So why is this important to you as a social worker or as a social service provider?
You may be in a unique position to discern when someone is being trafficked or in danger of being trafficked. You may also act as a knowledgeable, safe person to someone in a potentially dangerous situation. You may also be in a position to influence policies within your agency or institution to support youth who are being trafficked.
We chose this image to introduce the concept of exploring implicit bias to give you a contrast from the imagery from the various human trafficking awareness campaigns. Young people who have survived or are still involved in sex trafficking are often just young people in our communities. If you are looking for people who embody the images of these awareness campaigns, you will miss people who need your help. Implicit bias is our unexplored, subconscious set of assumptions about human beings based on who we perceive them to be. We ascribe positive and negative attributes to people because of these biases, and we often treat them accordingly. Our biases may reinforce who gains access to supportive services that we know about and who does not. A few examples of those are thinking or assuming that masculine people cannot be sexually assaulted, so we don't need to talk about those kinds of services with masculine people. Believing that intimate partner violence only happens between straight people, or not thinking that trans folks might need to talk about intimate partner violence. Perceiving that sexualized behavior in young girls is normal in certain racial groups and certain socioeconomic statuses and not in others. These assumptions can impact how we provide services to our clients and our patients. For instance, a person who has experienced trauma may not always be the most pleasant in demeanor. They may not be adherent to medications. They may no-show at multiple appointments. And combined with our own implicit bias, we may fail some of our clients intentionally or unintentionally.
In our Adolescent Initiative at the Juvenile Justice Services Center, we very much believe in a model of trauma-informed care. So if we're implementing a trauma-informed model of care, this can diminish harm and enhance care for the individuals who have been sexually exploited and victimized. This just means that we are realizing the prevalence of trauma in our patients, realizing how it affects all individuals. Jasmine explained a few examples just now about they might not be the most pleasant client, or they might miss appointments, or they might give you a lot of resistance. And we respond by putting this knowledge into practical application. So we want to let you know that as sexual health providers, this is what a trauma-informed approach looks like for us. It will be different, of course, for social services, but when we are providing sexuality education and services to a young person, we are not just saying, well, we're going to talk about condoms, we're going to talk about the symptoms of STDs. It's not just the practical scientific information. We are providing this information in a therapeutic process of best practices for childhood trauma. So we always meet in a confidential space, which is very difficult in a juvenile detention center. We emphasize that there is patient confidentiality, that we're not going to share their business with other young people or the staff of the center. We meet in private spaces. We really put an emphasis on youth's feelings of safety and comfort. So they make all decisions related to the content we talk about. If we bring up a subject that they don't want to discuss, that's the end of that topic for the session. That doesn't mean we won't revisit it, but we are never going to force a youth into conversations where they are not comfortable. Sessions can stop at any time, driven by the youth's decision to stop. And for us, we find that young people in detention are very grateful that they actually have the ability to make a decision about something, because most of the time in detention they don't have any choices to how their time is spent. Participation in our program is always voluntary. So even if we get a referral from a judge that says this is a trafficked youth, we would really like you to work with them, if that kid is absolutely 100% not into talking to us, nobody forces them. We do the courtesy of a first meeting, and after that, it's really up to the young person. And We do find that most youth want to engage with us. I think because of our style, they feel respected, but we do not force them. We are always looking closely at how the youth respond and react to the things we're talking about. And we do spend quite a lot of time normalizing their responses to trauma. Kids will be like, I don't know why I'm so mad all the time. I don't know why I feel so guilty about this. And we spend a lot of time being like, you experienced X, Y, and Z, and as a result, it is completely normal to have these emotions. And this is often with youth who are living in systems where they're not really encouraged to express those emotions because they might be in a detention center, a group home, a treatment facility where, you know, the adults working there don't necessarily want to manage all those emotions. So we create a safe space for those emotions in our sessions.
So for you all, what to look for. Some of this will be a reiteration of previous slides because a lot of this reflects what was on the risk factors slides. But some of the things that we are screening for, and you also may be screening for if you're working with any of these young people, is a lack of family or social support, substance abuse or addiction struggles, poor health, malnutrition, evidence of physical abuse, severe dental problems, repeated STI infections, unexplained absences, irregular school attendance, chronic running away, and transient and homelessness, unstable housing situations, whether alone or with family members. Abrupt changes in things like behavior and relationships and attire, deferring to other people, the presence of usually an older boyfriend or male figure who may or may not be introduced or talked about as a family member or a boyfriend, deferring to that person, the presence of this person at all kinds of appointments, having that person monitoring them, calling them constantly, texting them constantly, traveling with this person, talking about frequent travel to other cities, and having answers that sound very scripted or like the things that they expect that you want to hear from them when you're speaking with them about how they are.
If you are working with a client or a patient and you believe you have identified a potential child victim of human trafficking, there are several things that you can do. So if it is an emergency situation, if the young person you feel is currently in danger, is currently under the control of a third party, you can call 911. That would be an emergency. If your agency can't respond, that would be like if the report doesn't meet the legal mandate for Child Protective Services involvement and you can't call your Child Protective Services agency about it, you can call the National Human Trafficking Hotline. And we put the number up here and it'll be on another slide at the end, but we would encourage you to jot this one down. It's 1-888-373-7888. So when you think about responding to trafficking, there are a few things we would like you to consider, such as, does your agency have written policies and protocols in place to respond to a situation in which someone comes forward in need of help? Does your state identify you as a mandated reporter of abuse? Yes, for us in Pennsylvania, Jasmine and I are both employees of a children's hospital, and as such we are mandated reporters. So I did see a question earlier where someone asked, how do you deal with being a mandated reporter? And what we do is we identify ourselves as mandated reporters up front when we speak to young people. So we let them know everything that you talk to us about is confidential except for, and I'm sure you're all familiar, it's if you are going to hurt yourself, if somebody else is hurting you, or if you are planning to hurt another person. And we tell them that this does include sexual behavior. So we put it up front that we are mandated reporters. So a lot of things that you might hear as social service providers would fall under the category of having to make a report, and we have certainly made plenty in our work. If you are a professional with a licensing body, for example, if you are a licensed social worker, does your profession or licensing body have ethical guidelines surrounding human trafficking? Think about whether or not your community, where you live, your city or town, is equipped to provide assistance to people who have survived a human trafficking experience. We do have a lot of resources in Philadelphia, but I am guessing that it does not look that way in every other place, especially more rural communities. And if you are working with someone who has been trafficked and requires immigration or homeland security assistance, that is a very big, tricky, whole other issue, and you would need to seek assistance from the Department of Homeland Security.
The final question is asking, what are the consequences for incorrectly reporting an instance of human trafficking? When we're asking about consequences, we don't mean that you will be penalized for incorrectly reporting suspected sex trafficking. We're asking people to consider carefully whether such allegations are founded before making a report. We don't necessarily want you to finish this webinar and run out and start calling these numbers about every young woman who's in foster care who has an STI. But we are asking people to consider their implicit bias. So, for instance, there are times when we may assume someone's innocence or assume someone's greater likelihood of criminality based on who they might be or who they might be to us in our perception. One example of that would be there was a story in the news several weeks ago. There was a gentleman who was on an international flight returning to the U.S. from Mexico. He was taking his young daughter to visit his mother, and a woman sitting in the seat next to them told the flight attendant that she believed that this man was trafficking his own daughter because he was in an interracial marriage. The child was lighter skinned than he was, and for whatever reasons, possibly implicit bias, that's what I would probably argue, she assumed a sense of criminality about this man that was not there. He was simply taking his child to see her grandma. So we'll get into some like nuts and bolts, nitty-gritty, practical suggestions that we have for you as service providers, do's and don'ts. So for instance, Erica already pointed out, we don't have this one written in these next two slides. I would say absolutely, if you are a mandated reporter and you have a legal obligation to call in certain kinds of things, do be upfront in the very beginning about your status as a mandated reporter. Allow people to make their own choices about the kinds of information that they want to disclose to you. If they end up disclosing to you anyway, then they were ready for the information to be reported. Do ask a broad question, something like, have you ever had to do something in exchange, something sexual in exchange for something that you needed? Broad questions that are neutrally worded will generally allow people to answer and be more comfortable with the answer. Some people may not be familiar with certain terminology that you might use. I will go back and forth between these two slides. At the top of this, we're saying don't ask questions like, are you trafficked, which is an actual question that someone was asked that we were told of this story, and this young woman did not understand what the term meant. She didn't know what the person was talking about at all, but it would have been more helpful if she had been asked, has anyone ever forced you to do something sexual against your will for money? So keep it general, keep it neutral, keep the questions broad. Do deal with your personal feelings elsewhere. Please do not make these people take care of you while they're telling you about their lives. Please realize that people may not realize that they are victims, may not feel that they are victims. They may feel that they have some control over what is happening. If people don't perceive themselves to be victims, it's not really necessary for you as a service provider to force them to tell you that they are a victim. This is something that happened to a young woman that we are working with currently. Her attorney insisted that she admit to her that she knew that some behaviors, some activities that she was engaging in were wrong and that she was a victim, even though she didn't feel that way. But it didn't really do anything to benefit this young woman whatsoever or influence her case in any way. It was more about the attorney. Please do not ask questions that are not essential to your service provision just out of curiosity. Things like, but did you like that? Or is that something you enjoy? Those kinds of questions aren't really beneficial to the person that you're trying to provide services for. Please do not judge your young people. They will be able to tell. Please do not bring your own moral biases into your questions. One of the words that Erica and I hear most frequently is promiscuous. Words mean things. These kinds of words have judgment and bias embedded in them. If what you want to do is help someone, you'll have a better chance of doing that if you don't put people off with the language that you choose when you're talking to them about their lives and their decisions that they make out of necessity. Please avoid acting shocked or saddened, gasping and doing head shaking and clucking and things like that. Please understand that some people who are trafficking victims do not want to be saved, that you may not be able to save them, and please do not have the expectation that they should be grateful to you. People may be resistant, they may be combative, they may be difficult to read. These are coping skills that have likely benefited them in the past, and it is not about you.
So I would like to add, we're not asking folks to not have feelings. We know that you're social service providers or medical providers, and you're in a helping profession because you care about people. And we care about all of our young patients, and we have a lot of anger and rage and sometimes still shock about things we hear, and we work those feelings out with each other separately away from the patient. It does not benefit your patient if these things necessarily register on your face. We had a young woman tell us just last week that she was having a behavioral health evaluation done by a court order, and this is a 19-year-old who engages in sex work and does exotic dancing. And she told this to the person doing her behavioral health evaluation, and immediately the woman responded with, "Oh my gosh, are you going to keep doing that? Why do you do that?" And she took a tone that was very patronizing, and our client immediately was shut off. And she was very dismayed by the reaction of this woman and did not want to continue talking to her. Meanwhile, she has told the two of us innumerable stories about the things she has experienced, and probably because she feels comfortable that we are not going to respond with that kind of judgment.
And one of the main reasons why we're giving these suggestions is because we're not investigators. We are service providers who are trying to engage people in ongoing, regular medical care. So we are not trying to extract information from people long enough to make a call to the police about what's happening. We're trying to build trust and build a rapport with people so that they feel safe in engaging in their medical care and are not disconnected from medical services. We want people to feel comfortable and feel safe and to return.
So this slide is particularly important to us. It says, anyone who considers themselves an advocate for sex trafficking victims should consider themselves an advocate for commercial sex workers. What we mean by this is that no matter how a patient or client becomes involved in sex work, you should treat them all the same. Whether it's a child who fits the profile of an anti-trafficking campaign, which there are plenty, including the Maxine example we gave you. She was a young woman who was captured and held at gunpoint and beaten and taken forcibly off the street. Whether it's a Maxine or a young person who makes a conscious choice to engage in sex work in order to meet needs, perhaps to fuel an addiction, such as Trina or Sheila, we want you to be an advocate and service provider to all of them. once again, here are two phone numbers that will be important that you should perhaps take down, keep by your desk. These things are also available if you Google how do I report human trafficking. It should be the first hit that comes up. We'll leave it up for a second so everyone can copy it. A few other resources that may be of interest and are some of the places that we got our supplemental information from. The Department of Homeland Security Blue Campaign is our government's campaign against human trafficking. The Polaris Project, the National Center for Missing and Exploited Children. And there is a training designed specifically by the Health and Human Services government department to help healthcare workers identify and care for victims of trafficking. This is called the SOAR training, Stop, Observe, Ask, and Respond. We put the website for that up here, but also, again, if you Google SOAR training for trafficking, it will come up immediately, and that would be great additional education for folks. So we felt like we couldn't do a presentation about this topic without recognizing two of our patients that were very important to us and that we highlighted in our case examples. So Sheila and Trina, they were not their real names, but they were both young women from Philadelphia who struggled with addiction, lack of family support, abusive pimps, and abusive people in their lives. A very shocking lack of resources to help them even when they were asking for help, and a situation that was just entirely unfair. So we are very affected by their loss, and we will not forget them. So we hope that you can do this work in their honor.
Thank you, Erica and Jasmine, for today's discussion, and thank you so much for the work that you do. I'm so honored that I've been able to work with you for all these years. And at this time, we want to continue to hear from you as you answer some of the questions that folks are going to provide. So please type those in, and we'll be able to take a little time to answer some additional questions on any of the information that you heard today.
So one of the questions, how do you get these youth to see themselves as victims, or do you want them to? I believe Jasmine addressed this in the do's and don'ts portion. She shared a story about one young person who had been the victim of sexual assault by an older person, but this young person perceived them to be in a relationship, and she perceived herself to have agency, although the law did not perceive her to have agency. And what we saw was her public defender wanted her to say that she was a victim, wanted her to feel that she was a victim, and that did not benefit the client in any way, and in fact made her feel even more powerless than she already feels in her situation. So we definitely are not in the business of insisting that the young people we work with see themselves as victims, because we want them to heal and we want them to ultimately have agency over their lives and outcomes. And if you're telling them from the start you don't have agency, then trying to build it back up is going to be an uphill battle.
I see. There's a question about whether clients are eligible for long-term psychotherapy and has that been helpful for them. The answer is complicated. We would, of course, recommend that anyone who is willing to participate in therapy have access to it. There are some organizations locally in the Philadelphia area who can help with various kinds of talk therapy, including Women Organized Against Rape, Women in Transition. As we said previously, the Salvation Army has a program for folks who are sex trafficking victims. The Covenant House has a program for trafficked folks, but a lot of the young people that we're talking about are people who are living in poverty, and therefore they only have access to free services or services that are subsidized by the government, and those are very sparse. There is not a lot of funding for care of this kind, and we really, in my opinion, should dedicate more resources to this kind of work. But it's very difficult to help people who are in poverty.
One person wants to know, how old was your youngest client, and do you ever involve caregivers or family members in your work with your clients? We have worked with youth as young as 12 years old, but our program specifically doesn't have much of an opportunity to work with families. A lot of our young people are not living in supportive family structures, so we do continue work with youth outside of detention if they're interested, but we don't often come into contact with their family members. It's usually very much youth-directed.
Mm-hmm. Sometimes we do have involvement with families, and it's always kind of novel and refreshing, but one of the reasons why a lot of these young folks are at risk for being victims of sex trafficking is because they already are experiencing a lack of family support or neglect or abuse. It should also be mentioned that a lot of the young people that we work with, whether they're victims of human trafficking or not, also have family members, including parents, who are incarcerated. So that immediately can be very disruptive to the stability of the family.
One person asked that it seems that the Super Bowl has been a trafficking mecca for quite a long time, and why haven't awareness and education slowed this trend? I don't know the details about what kind of targeted enforcement is happening around this particular event, but I can say that in general, there's always a demand for sexual services from youth, which is a really hard reality for us to accept, but it's true. There is always going to be a demand, and where there's a demand, there are going to be folks ready to provide the supply. And something hard to think about is that a young person can be sold over and over and turn a profit for the person who's controlling that. So we know that there are people working to do some cracking down again around big events like the Super Bowl, but in general, these are the reasons that there's still a demand.
I'm seeing a question about working with folks who disclose a history of trafficking and their affect being flat when working with a young person, and how do we recommend clinicians respond to that? Yes, we're just jumping in at this point.
The question is about, are we asking clinicians to respond with a flat affect?
Oh, I see. I don't know if I could tell you what affect you should use. It doesn't necessarily need to be flat, but I also don't think that, how do I put it? I don't think you have to react by being visibly and audibly dismayed, if I could put it that way. It's fine to be warm and caring and say, if someone says, I've been sexually assaulted, it was very traumatizing to me, it is absolutely okay to say, I'm very sorry that that happened to you, it is not your fault. But you don't have to speak in a monotone or act as if you are not a caring professional. It's absolutely possible to be a caring professional without being dismayed.
I think that between a flat robotic effect and gasping and, pearl clutching, there's a lot of gray area in there, and we definitely exist in that gray area. If a young person is talking to us and disclosing traumatic information and they view it as traumatic and they're crying, we look and respond in a caring fashion, but we also don't say things like, oh my God, like,
this is so awful.
Yeah, this is so sad, this is so tragic. Like, that kind of language will definitely turn a youth off. But if a young person is telling you about their sex work in a matter-of-fact way, where they're not, like, sad about what happened to them, they're like, yeah, I've done this, I've done that, definitely don't respond with the gasped and the shocked. We're just reading your questions. It seems that we're getting another question. We're confused by your recommendation of not appearing saddened. We didn't say that you can't have emotions. We understand you have emotions. It just will not benefit the young person if they are like over the top, shocked and saddened to their face. One person asked, clarifying question, across the U.S., youth under 18 are considered trafficked no matter what state they live in. This is true. And then they asked, what about those emancipated by court? I honestly don't know the answer to that.
I don't either.
My guess is that federal law would have still applied to anyone under 18 regardless of their status as an emancipated minor, but I would need to verify that.
Is there a greater risk to victims of trafficking after they come forward or speak out, similar to domestic violence victims, is the question. I would imagine that, yes, in many instances, there is a greater risk. If the third party involved is basing some of their income from this person's labor, and they come forward, they're interrupting that person's flow of income. So I would imagine that that would put some people at far greater risk after coming forward.
This is especially true in cases where a trafficker, a third party, a pimp, is worried about being told on. For example, some of the young women that are held in detention are being questioned by prosecutors and by the FBI so that cases can be built about pimps and traffickers. And if the pimps and traffickers are worried that these young women or young people are going to talk, the threat of violence is absolutely present. We do believe that the young woman, Sheila, the example we gave you, is widely believed that she was murdered by a pimp for this very reason.
There's a question about providing some information about practical, effective ways to support young people who are engaging in sex work who don't identify themselves as victims and don't want to stop doing sex work at this time. That's probably the majority of the people that we work with. It's not our purpose to try to convince people to stop doing what they're doing. Our perspective, our point of view is about trying to ensure the best health possible for each person. So I feel that a lot of the suggestions that I would give are suggestions that I would give for increasing optimal health for all adolescents. So giving people clear and accurate sexual health information, giving people routine and regular access to good medical care, giving people access to things like birth control if they want it, giving people access to, hopefully, mental health services, and other services that are the kinds of services that if people had access to it, they might make different, it might influence their sexual decision making. So one of the biggest barriers that we come up against with young people is poverty. And we're going to say it over and over again. If people don't have a place to sleep, if people don't have anywhere to live, if people can't afford to get to their medical care, or they can't afford bus fare to get to school, these things are true and genuine problems for people. And these things can impact people's sexual decision making. Those are the kinds of things that I would suggest people do to support young people who are engaged in sex work. Just making sure that they have as much information as possible so that they can make the best choices for themselves and for their own health and for their own bodies. So we've had a few folks asking about outcome data for our program. Since our primary goal is HIV prevention, we are really, and we're not research, we are just a social services health-based program. We are not tracking probably all the kinds of things that folks are wondering about, like if young people stop sex work, if they return to sex work. We are really tracking sexual health outcomes. And in the first 10 years of our program, we know that, in the first 10 years of our program, out of all the youth that we followed intensely, we know that only 3 people seroconverted and became HIV positive. But the only thing that we definitively track is the HIV status. There was another question about how to support young people who do want to stop engaging in sex work. And again, I feel like I'll probably end up repeating myself. One of the biggest factors for engaging in sex work is necessity, is poverty. So we're trying to help link people to as many supportive services as possible in order to change their living situation so that they can make different sexual decisions. So that means helping people to access housing, which can be very difficult. There can be a very long waiting list. To have people access regular, routine, good, competent health care. To have people in therapy if they need therapy. To have people in trans-affirming health care if that's what they need. Anything that would help to provide a person with a more stable day-to-day living situation. Child care, education, job readiness, helping people find employment or get ready for employment. All of these things, there were a few slides back in the presentation about very short-term and also long-term resources that people might need. And helping someone to become stable enough to stop engaging in sex work is a long process. It may be a cyclical process. People may stop and start and stop and start, depending on the circumstances of their lives. But however stable the rest of their life is will be a huge influence on whether or not they feel that they must continue to engage in sex work. Someone is asking, do you consider incarceration a good place to keep the victims segregated from other folks? We see that in our work in the Juvenile Detention Center, many young people that are being held there who are victims of trafficking are being held for their protection, often while prosecution is being sorted out for the trafficker. So there are definitely pros and cons to this. A pro is, of course, they are away from the trafficker. But being in detention can be a very traumatic environment in and of itself, and it can also make a young person who is in there for their protection feel like they are being treated as a criminal. And it is something we hear time and time again from the young people that we're working with, is that they feel like they're being punished, even if they're not actually being charged with a crime. I'm seeing some comments about whether or not in a particular locale, folks who are victims of human trafficking or folks who are sex workers, I can't tell which from the comments, whether or not they can or cannot stay in certain shelters based on certain regulations of organizations and institutions. And it's one of the things that we were suggesting in a previous slide about knowing what the resources are in your community and having some detailed information about what they are, not just saying, oh, hey, there's this shelter over here, why don't you go and see about an intake,
when you might have saved the person the car fare if you had made a phone call to investigate whether or not someone in their life circumstances could even be heard for intake. So it's important to do your research in advance if you are going to be someone who ends up engaging with or working with folks who are involved in sex work or who are victims of human trafficking. Know what the resources are in your area and what the resources are in, if you're, for example, in a rural or suburban area, know what the resources are in your nearest metropolis or metropolitan area as well. Someone asked what kind of alternative supports are there for youth who have been trafficked. It seems like a lot of youth went back to the work, and are there financial support groups or scholarship programs? This is where things are very difficult. The reason that most youth engage in sex work without a third party is because they are trying to find subsistence needs like food, shelter. That means they are living in poverty. And there really aren't easy ways to get out of poverty. So there are not programs that really provide a stipend or anything like that. There are programs like transitional housing for youth. We call that independent living, where a young person goes and lives in an apartment that's through a program that eventually is with the goal of trying to get them living independently. And those programs can be helpful, but that also isn't going to completely curtail a person's desire to do sex work. I think we mentioned earlier that in Philadelphia there is a Salvation Army program, and that they recently opened a safe house, a Salvation Army safe house in Norristown, right outside of Philadelphia. So programs like that have been helpful to young people who are the victims of trafficking. But really curtailing it altogether by providing financial assistance it's very, very difficult. There's a question that says, do you think that legalization of sex work would impact your work? My answer is no, it would not impact my work, because our program is not designed specifically to engage with people who are sex workers. It's one of the populations that we work with, but whether or not the sex work that folks are doing would be considered legal or illegal in the eyes of the law, our purpose for being engaged in work with them is to provide them with access to health care and to provide them with information to increase good health outcomes for them. So for us, the work wouldn't impact our work. We would still want to make sure that people who are engaging in legal sex work had access to routine health care, had access to condoms and birth control, trans-affirming health care, therapy, trauma-informed care, etc. So all of those things would remain the same for us. Someone asked, what about job readiness programs? Those are certainly helpful for a lot of the youth that we work with who are in juvenile detention. Programs like Job Corps or Youth Build may be helpful. So we would definitely encourage folks to look into that as a resource. So as we close, we really want to remind folks that it does not matter how the young people came to be in your care or how they came to be in trafficking, if they were forced by a third party or if they entered into it with more agency. We feel like they are all going to be deserving of the same care on your part, and a lot of them are going to have the same basic needs. So we really want to emphasize that point.
So this concludes today's webinar. We ask that all attendees please complete the online REDCap survey that's going to pop up when we end the webinar. As a reminder, if you are a social worker and would like to claim continuing education credits for the webinar, you are required to complete this survey. The resources given at the end of today's presentation will be provided in an email to participants that participants will receive at the conclusion of the webinar. This was a terrific, engaged group of participants. Thank you so much for all of your questions. We really appreciate also all that you do to help protect and enrich the lives of children. We hope this webinar was useful and actionable for you. I especially want to thank our presenters, Jasmine and Erica. Again, please remember to take the time to complete the survey that's going to pop up when we end the seminar. And at this point, we are going to end the webinar. Goodbye, everyone, and thank you.